name is Pam Mitchell. I've been a diabetic 41 years since the age of 10, and that led to my diabetic ulcers on my feet. I had a stage 4 ulcer on my left foot. The doctors wanted to amputate my feet. They had tried numerous IV antibiotics over a period of a year. I had tried Oasis, warm-up therapy, and numerous treatments, debridement creams, and nothing worked. The doctors told me to think about amputation. By chance, a friend was watching the Learning Channel, and she saw Maggot therapy that they use in Europe and what great results they have. I asked my doctors about the Maggot therapy. They told me that it wouldn't work for me, that my ulcer was too deep, and because I had osteomyelitis. After the doctor did surgery and they debrided my wound, I had an ulcer that was about 1 inch deep, 2 inches around, with a ½ inch of exposed bone. A couple doctors told me to give it up, have my foot amputated, and see a psychologist. I didn't think I needed to see a psychologist. I just wanted my doctors to do everything they could do to save my feet. I kept asking and pushing the doctors to do it, and they sent in a doctor that had done it one other time before on a patient, but whose wound was not as bad as mine. He came in, looked at me, my foot, talked to me, asked me what I expected the maggots to do, and I wasn't really sure. I just knew that I wanted to try it, that I was willing to try anything. And we talked about them just cleaning up the infection, that we had no idea what they could do. At the time, the doctors had to do it in their offices because they didn't have a procedure code at the hospital to do the therapy. And I had to go to my dermatologist's office. He put the maggots in his office. They stayed in for 2 days. My orthopedic surgeon took them out in his office, and he was amazed. They worked on the bone, they were cleaning up the infection, and he had never seen the maggot therapy before. He was just totally amazed how they were clearing up the infection and actually working on the bone. At the time, I had gotten a rare bone marrow disease, myelodysplasia, from one of the antibiotics I was on. They didn't know that was a side effect at the time. I was very sick. My blood count had gone down to 6. I was gray. I lost half my hair. They had sent me to Cleveland Clinic, where they were planning on doing a bone marrow transplant. They had tested both my brothers to see if they could be donors, which they could. And I was hoping for a miracle, and the maggots did that. They actually got rid of the osteomyelitis. They took me off the antibiotic, and the myelodysplasia cleared up. The maggots totally healed my wound to very small. I had to use Promogran in the end to totally close them, but the maggots did a miracle. And I highly recommend to anybody, to any doctor, to try before amputating a patient's limbs. The maggots saved not only my feet, but they saved my life. I did take some harassment, but it was worth it. I did have some discomfort because I do have feeling in my feet still, and I wouldn't think twice about using maggot therapy again.